Good afternoon. This is Chuck O'Neill, Deputy Director with the Kentucky Board of Emergency Medical Services in Lexington. It's 3:01 on March 17th. This will be a recorded meeting for ambulance administrators throughout the state of Kentucky. I'm going to turn the duties over to the Executive Director for K-Beams, Mike Pointer.
Thanks, Chuck. Mike Pointer here, Executive Director for the Board of EMS. I'm currently in Frankfort at the State Emergency Operations Center. Each of you are well aware of the situation we're facing right now, not only in Kentucky, but across the nation. And I suspect from what we can gather and the other disciplines I've talked with, it's going to get a little worse before it gets better. Right now, we're expecting to be staffing the EOC. Right now, the minimum of 4 to 6 weeks. The K-Beam staff, we will be here during all operations, and our goal is to gather information for you. If you have needs and requests to help process those, this is going to be a long, very large operation. I want to make that clear. This is something that we probably have not seen in our lifetime. It's going to change the way we live for a period of time. Now, I'm not going to be a pessimist, but I want to be factual and realistic about this. We're over here in Frankfort at the Operations Center with the other ESFs, or the emergency support functions, which basically has to do with each different infrastructure, critical infrastructure that keeps our economy going. So what we've decided to do is to reach out to each of you, and I would like to do this on a somewhat regular basis, but we've been gathering information over the last few days, and we wanted to go through each discipline in K-Beams and pass along to you some guidance and resources and documents that we've put together so to better help you operate in the near future. We are here for you. We will do anything we can to keep the continuity of operations as normal as we can. But as we go through each discipline today, I think we'll be holding questions till the end. But with that, I will turn it over to Paul Phillips, and he'll start the administrative section off. So, Paul.
All right, thanks, Mike. So just a little update on operations throughout the state. First thing, we are going to delay / suspend all agency inspections until the end of March. This is done just in an effort to make sure that you guys are able to focus on the things that you need to focus on. I don't think you all need any of us there trying to look over your shoulder right now. I think you all need to make sure you're allowed to focus on the things that you need to. So again, if you have an inspection scheduled between now and the end of March, just consider that as postponed. Your inspector will be in touch with you to reschedule at a later date. They should be reaching out to you. We just made that decision today, so bear with us as we make notifications on when your date will be. We won't set those dates probably for another couple of weeks, because basically what we're doing is just suspending until the end of the month, and then we're going to reevaluate. Just as you all know, we don't really know how long this is going to continue on, so we'll be making those decisions and changes as we go. Second, yesterday we sent out a PPE survey to try to get a handle on PPE levels and PAR levels across the state. So far, I looked right before we came on, we had like 71 responses. If we could get the rest of the state to fill out that form, it would be great. It would help us to kind of get a handle on where we are with PPE supplies across the state. If you didn't receive that email, first off, if you could jump into your Chemsys account and make sure that your email is up to date, that would be great. If not, you can change that there. And then also, second, We have posted it on the KBeams website, the COVID update website that we have posted there. It is on the front page. We've got that banner that runs across there. If you just click on that there, you can access that survey, and then you can just submit it to us, and we'll figure out from there, the levels across the state. Third, we've also posted today, and you should have received an email last Thursday or Friday, that you can request PPE through the Kentucky Department of Public Health. Now, with that said, they are prioritizing those distributions to the places that either have been affected or neighboring counties. That's not to say that you won't receive if you ask, but they are prioritizing just to the areas that have been affected so far. So just know that there's no harm in submitting your request, but just understand that if you get denied, it is not due to there not being a need. It's just due to limited availability and trying to prioritize those supplies as we can. I think that's all I've got. I'm going to hand it over now to Bob Andrew, our Director of Education and Training.
Can you hear me? Hello?
Everyone's muted for you, Bob. You've got the audio.
Oh, okay. Thank you, Chuck. I have a slide on the screen if you can see it. If not, I'll go through it. The first thing on the EMS TEIs, we're aware of the many issues that the educational group is having with their courses. This is involving the clinical field rotation suspensions, suspending classroom meeting, moving to an online format. There's been a recent testing suspension with Pearson View through NREMT. So we have pretty significant issues with EMS TEIs that we're working on. We hope to have some guidance out this week through a communication. I'll be releasing through the Constant Contact newsletter that I've done in the past, the Education Matters. So we'll have information on there for these folks and how we're proceeding with that. NREMT has extended their March 31st renewal deadline for this cycle to June 30th of 2020 for now. The COA EMSP, which is the Committee on Accreditation of Health EMS Profession, and this group oversees the paramedic programs and accreditation, and they have a separate set of guidelines that they have to meet. There are some issues that they're having with them involving some clinical field rotations, team leader issues that we're aware of and that we're working on, and we hope to have some additional guidance from COA on that, where we're hoping that they'll be relieving some of these requirements that they normally have in place under normal circumstances. Certification and licensing, as far as processing goes, we're processing as we normally do. We're not having any issues with that. Our staff is working in office and remotely, and we're going to be able to process license and certification applications as we normally do. American Heart and other educational institutions or entities are releasing guidance for their programs. You'll probably see more of these in the coming days from other educational entities that the board has approved as continuing education options like CPR, ACLS, things like that. We will fully support their recommendations for their programs and any extensions that they grant. American Heart is granting up to 60 days for cards that expire in order for folks to get those courses renewed. The biggest thing that we're working on right now to relieve a lot of these issues are some emergency regulations. So with certification and licensure, a lot of education is connected to that through continuing education requirements that we have in order to obtain certification or licensure, to renew, reciprocity, reinstatement, and so on. This also involves the EMS TEIs and the issues that they're having completing their courses because of our existing regulations. So we're drafting up some relief through these emergency regulations, and we'll be proposing those to the board. Hopefully we'll be able to get these through. And the intent is to provide relief with these regulation changes from present day through the December 31st, 2020 certification cycle that we're in. That's all I have.
Thank you, Bob. And we do have the chat feature enabled at the bottom right corner of your video screen. And we'll be querying those questions, and we're going to take about 20 minutes at the end of the talk here to answer some of those. So you can feel free to bring some of those in. Kaylin is here and is going to be compiling those for us, and we'll try to get to those after we've given our reports. Next up is Drew Chandler, who is the data administrator for K-Beams. And Drew, you are unmuted.
Thanks, Chuck. Good afternoon, everyone. I won't take a whole lot of your time, but I wanted to talk about some of the communication strategies that we are using and will continue to attempt to use to share information both in a guidance capacity and a support capacity. The first thing I'd like to recommend is that you visit the K-Beams website at kyems.com, and under the K-Stars heading in the gold bar, there's a page dedicated to our Heads Up Kentucky EMS application. The Heads Up application allows us to send out push notifications. They go instantaneously. They'll work on cellular or Wi-Fi, and it is not dependent on KEMSYS or any other system. You don't have to access it via our website. That's just offered as a shortcut. If you're comfortable searching the Apple App Store or the Google Play Store, you can search for Heads Up KYEMS and then download that application. There's a few different audience features. It's a very intuitive platform to use. And the best thing is you can see all the messages that have been pushed out prior to you actually downloading the application. So we are going to continue to try and use that. And anything that goes out mass communication via email will probably also be sent out via that Heads Up app. That brings us to email. Paul mentioned logging into your KEMSYS account and making sure that that's up to date. If you have trouble receiving emails from us, you might temporarily change from your work email address to your personal email address. It's not a recommendation, it's just a suggestion for you to get timely notice. We have also set up a support ticket category for COVID-19 that as soon as you click save on the support ticket, it will route the question to everybody that's working on COVID-19 related activities to ensure that your question is answered in a timely fashion. So again, download the Heads Up app, make sure your email address is up to date, and also use the COVID-19 category in our support portal. Switching gears a little bit, Paul mentioned the need to input your PPE PAR status. We will be doing that in the near future for personnel status related to staffing and looking for trends. Our analyst, Monica, is working with public health for near real-time surveillance, and your input is not a wasted effort. So we're doing that for PPE and for personnel status. Also, related to patient documentation, please, please, please go in to your PCR software and make sure the questions in the other group related to crew member PPE are turned on, because we can use those to track PPE utilization during calls. And get your pencil ready, because I'll tell you exactly which ones they are in just a moment. But on every patient encounter, if you can complete the PPE consumed, we can get that out of the report writer in near real time and let our colleagues at public health who are receiving and requesting assets from the Strategic National Stockpile near real time what's being used on the streets. So those questions are other 0.03 personal protective equipment used, other 05 suspected EMS work-related exposure, injury, or death, and then other 06 type of work-related injury, death, or exposure. Those three NMSIS elements, if you could please add those to your run sheets, it will help us do near real-time surveillance and hopefully replenish your PPE inventory. And that brings me to the end of my talking points. I just want to say, reach out to your emergency management colleagues in the county. The presidential emergency declaration is a little bit different than what you might be used to for a natural disaster, such as a flooding or an earthquake or a tornado. Make sure that you're utilizing all the tools in the toolbox and you're documenting appropriately. And I believe Chuck may talk a little bit more about that. So from my family to yours, thank you. We're only going to get through this together, and keep up the good work.
Thank you, Drew. Again, this is Chuck O'Neill, and with the Board of EMS, I'm going to talk about a few things that should have already hit your email inbox. We have provided several guidance documents. Those are not required, but those can be utilized at your agency. One of those that went out, I believe, last week was a guidance document for with a flow chart for patient assessment and PPE when encountering patients with symptoms of COVID-19. One of the other documents that we prepared and sent out actually to dispatch centers throughout the state, to every 911 center, was a dispatch triage guideline for COVID-19 screening. If you are not aware if your dispatch center, your local dispatch center has implemented that, or if they have power phone or priority dispatch for infection control screening, I would try to make sure that you're contacting those and communicating with your dispatch center on screening those calls so that your crews can find out which patients may be positive for those symptoms, and additional PPE or slowing of the response may be necessary. I do want to stress to you the website that's up. If you're on video, we have a lot of information, and we've had a lot of information for several weeks on COVID-19 on the K-Beams website at kyems.com. If you go to the front page of kyems.com at the very top in a red box, that'll take you to this COVID-19 updates page that we have here. Monica Robertson, that works with us, has done some great work here. We've got the health alert coronavirus disease infographic that will give the symptoms, some of the demographics and epidemiology of the disease, and PPE and signs and symptoms here. And up above, you just put this one out. I think this one came out yesterday or this morning on EMS best practices. And Shane Bussell and the folks up in Harrison County that have had 5 or 6 of these patients in their county helped us to develop this with policy and procedures that they had developed there. So this EMS best practices document should be valuable to you as well, as far as working through the dispatch screening protocol, decontamination of the ambulance, and COVID-19 PPE. I do want to note that K-Beam's operations on a daily level, we're in the middle of a legislative session and everything is pretty much stopping for COVID-19. So I know myself and Paul and Mike, Drew, Bob, Kaylin, Monica, several of our staff are restructuring 100% of their daily activities towards COVID-19 response. The main thing that we want to do is make sure that we're a resource for you in the field, and that we're able to communicate with you on needs for PPE, supplies, regulatory changes like Bob spoke about, emergency regulations that may come into play. Some of those emergency regulations will be put into place, and we'll communicate with you when those are enacted. Some emergency regulations are being developed with the K-Beam's legal counsel and medical direction team to ensure that we have some liability protection for our folks in the field if we get to a situation where we need to triage calls or treat and release. So those things are all working right now. And response to patients with COVID-19, again, I would use this guidance. We are getting some information from the Department of Public Health that we do need to try to conserve PPE. So there may not be as much PPE as we once thought or hoped. That's why it's so imperative that our partners in the field complete those surveys. I think we had about 70 of those PPE cache surveys in, and we want to be able to monitor that. So before you contact us or before you contact the Department of Health, based on your K-STARS data and your call volume, which we're querying and we're doing surveillance on to see, we want to see if you're going to run out of PPE way before you run out of PPE. So make sure that you're honest on those and that you complete those surveys. We're going to be doing those surveys for PPE availability weekly to start now. We'll do those weekly. As the situation escalates, I would look for us to move to daily surveys on PPE availability, and we ask that you participate and complete those as soon as possible so that we can try to help you get the resources that you need. You got to realize that sometimes when we're dealing with health resources, we are in competition, not necessarily in competition, but we're all working together, but we're in competition for limited supplies with hospital systems, health departments, nursing homes, et cetera, when you're talking about federal roll down of PPE and medical equipment. So please communicate with us on those surveys, something that we'll be rolling out tomorrow as well. We're getting a lot of questions, and we all have concerns about our people becoming quarantined because they had an unprotected encounter with a patient that was positive for COVID-19. The state at this point in time, if you have unprotected contact as a healthcare provider with a patient with COVID-19 and are not exhibiting any signs and symptoms, they'll put you in 14-day quarantine. And if you start to develop symptoms, they'll put you in self-isolation for 14 days. So Paul is going to be sending out a survey tomorrow that we're going to be sending out weekly as well, because we want to try to stay ahead of enrolling some of the emergency regulations out. And the timing on those emergency regulations. We need to know what your staffing levels are, and if you are or are not affected by EMTs, advanced EMTs or paramedics that are in isolation, self-isolation for testing positive for COVID-19, or if they're in self-quarantine for encountering a patient without appropriate PPE. We did have a question during a Department for Public Health call, a webinar we did last week, about does it count as an exposure if you transport a COVID-19 patient but you're utilizing full PPE? And the answer is no, it does not count as an exposure and should not be viewed as an exposure if you're utilizing appropriate PPE and you transport a COVID-19 patient. So from there, we will roll on into question and answer. And give me just a second, we'll try to address the first question. and we'll do this for about 20 minutes. And if we don't get to your question or we're not able to answer your question at this point in time, we are recording this. We're going to put this up on YouTube later on today or early in the morning. And we're going to keep this log of questions so we know what your concerns are and we can continue to work through and address your concerns. Give us just a second. We'll try to get to the first question. Bob Andrew, Director of Education, you're unmuted, and the first question is for you. Bob, is it your understanding that the National Registry will still be conducting skills testing for paramedics?
Well, that's unclear. We're having a call with them. I think it's today, later on today after this call, and we'll find out more information. But Pearson View suspended the didactic testing, so I'm not sure if registry is going to continue practical skill testing without that being available, and the social distancing is trying to be accomplished. I'll have to find out, and that should be in my communication that goes out.
Thank you, Bob. Next question is, do you want, on the PPE surveys, do you want our PPE report to include any expired stock? I would say yes. Go ahead and include PPE expired stock. I think from several calls and communications that I've had, there's probably going to be times where we utilize PPE that is expired or past its expiration date, but may still be useful to us. So please do in your surveys provide us information on any expired PPE that you have in stock as well. Hold for the next question. The next question is K-Beams going to temporarily allow ALS agencies to have less than the normal 25% ALS coverage? Has there been any discussion about allowing non-certified people to drive an ambulance with a licensed provider in the back? And the answer to that question is all of these things have been discussed, yes. And the emergency regulations that are not going to be enacted until they need to be enacted will cover staffing guidance. It will cover response times, and it will also cover equipment standards. So we have not relaxed any of our regulations at this point in time. And I understand the state of Minnesota last week or early this last week, I think, completely deregulated everything. And the thing is if you completely deregulate the entire system, then we can't communicate with you or advise you on certain things. And we can't do our job and ensure that the public safety is being cared for by appropriate EMS. So we're not going to deregulate the entire system. What we will do is relax restrictions and regulations that will impair you from being able to take care of patients. And the majority of those operational emergency regulations are going to rely on if we have EMS agencies that have people that are getting sick because they don't have PPE availability or they're not using PPE. Hopefully all of your crews are using a PPE on any patients that exhibit the three major signs and symptoms, cough, fever, and respiratory distress. We need to be using PPE on those. But in the instance that we start to survey your staff and find that you have a lot of people that are on quarantine for 14 days or on self-isolation because they've tested positive for COVID-19, that's when we'll put those emergency regulations in place. And those emergency regulations will cover the 25% rule as other staffing variances, response time standards, equipment standards, and many other things. I'll hold for the next question. Next question is regarding the PPE surveys. Regarding the PAPR totals, are you also interested in cartridges, which will be the limiting factor on usage? We are interested in the PAPR cartridge numbers as well, if you can report those during your weekly survey. The next question is staffing is going to be an enormous issue. First responders are going to get sick. We do not have any type of backup staff or employees that get sick. I have no idea what we are going to do if or when this happens. And this is part of the emergency regulations that I was discussing with you all, and the need for you to complete the weekly surveys on staffing availability or staff that are off sick. I would encourage you that if you have staff that are off sick, whether it's COVID related or not, send them home. If you have staff that are sick, they need to be at home and not working, and you need to try to backfill. We're very resourceful, and none of us have ever experienced anything exactly like this. We work several MCIs and disasters and things of that nature, but this is pretty widespread, and the ability to backfill is impaired, obviously. Hospitals are going to be dealing with the exact same things. What I can advise you is to utilize PPE and to try to keep as many people available and not sick that we possibly can. One of the first hospitals that cared for a patient that had COVID-19 did not use appropriate PPE, and several of their staff were placed in a quarantine for 14 days. So at the beginning of the day, we need to be keeping clean ambulances. We need to make sure that we have PPE in stock and that our crews are instructed to utilize PPE because there's not, we will utilize our mutual aid plans that we already have in place. You probably need to monitor your mutual aid plans as well as your pandemic plans and policies and communicate those with your team. But if the patient numbers get to the point that we believe that they possibly could, mutual aid is probably not going to be available. So that's where some of those emergency regulations in that event, some of those emergency regulations will have to be put into place so that we can downstaff or triage calls at that point in time. Stand by for the next question, please. The next question is, we are reporting our PPE status as well as personnel to the incident management group, the IMG, at the local EOC. Can that just be forwarded to K-beams? The data can be forwarded to K-beams in the survey format that we're sending. The reason that we utilize surveys the way that we do in SurveyMonkey currently is that information can be brought into a Microsoft Excel sheet, so we can see total numbers as well as your local, regional, and jurisdictional numbers. So we do need you to complete the survey if you want our assistance in ensuring that EMS gets a seat at the table on some of these PPE issues. Next question is, can we staff using neighboring department personnel? At this point in time, you can staff using neighboring department personnel if you hire them and you put them on your personnel roster in KIMSIS. Otherwise, they would not be able to staff your vehicle. Next question is, what is a good plan for staff having an exposure? If you have staff that were not utilizing appropriate PPE, or they had an inadvertent exposure to a patient that tests positive for COVID-19. We've had this happen a few times in the state already. And normally what will happen there's a lot of communication that goes on with the local Department of Public Health and the State Department of Public Health. But your crews could come into a patient that they could come into contact with a patient that they didn't screen in as a possible patient with COVID-19 symptoms. Later on, the patient screens positive. Normally what will happen is those crews will go into quarantine for 14 days. If the patient is expected to have COVID-19 and they screen negative, at this point in time, these policies and procedures with DPH may change as the pandemic continues along. But normally, if the patient screens negative on their first test, then the crew is released from quarantine. We've had that happen a couple of times where we thought that a patient was going to test positive for COVID-19. They tested negative for COVID-19. The crews had no symptoms and they were released back to duty. In the event that there is an exposure, you need to remove them from duty, send them home, arrange for backfill if it's available, and communicate with your local Department of Public Health and the State Department of Public Health. And also please complete a new survey for us so we know that you have people that are in quarantine or in isolation. If you haven't in the past developed close relationships with your local departments of public health, we really need to start doing that. You need to reach out to them if they haven't reached out to you, and develop strong working relationships with your local departments of public health. And they have the ear of the regional coalitions and all the way up to Frankfort to the Kentucky Department of Public Health and the state EOC. The next question is, because we are under a state and national emergency, wouldn't EMS providers be working under a triage MCI scenario? This will give EMS providers discretion on transporting patients and would allow for some relief from liability. We don't know that that's the case or not. We actually have state attorneys in Frankfort that are working on this, as well as the K-Beams attorneys evaluating what the State Declaration of Emergency and the Stafford Act in Washington means for liability. One of the plans that we're working on at K-Beams right now is to have some emergency executive orders from the governor in place that will provide some liability relief from civil liability for treat and release and for triage on the scene. We're not treating this necessarily as a mass casualty incident at this time. I think we have 22 patients in Kentucky, and we certainly expect that we're going to have patients in every community and that those numbers are going to rise. But we hope that the scientists at DPH and at the CDC have been giving our politicians really good information about social distancing and canceling some of these events and canceling large gatherings. So we're hoping that we'll be able to keep those numbers reasonable and in check. And we've all worked MCIs and that type of thing. But what we want to do at the end of the day is make sure that patients that actually need to be transported and treated by EMS are treated and transported by EMS, unless the resources become unavailable. And we'll communicate with you guys one-on-one in that event. But we don't necessarily treat this as a mass casualty incident today. That being said, we are working on those emergency executive orders to put on the table and have available when staffing becomes an issue or patient volume becomes an issue for our agencies. Hold for the next question, please. This is a question for Drew Chandler, Director of Data Administration. Drew, I'm going to unmute you and I'm going to give you the question. The question is, are the NMSIS elements going to be made mandatory in the image trend software? And can you push PCR NMSIS 3.5? I think it's 356, so it can be forwarded to the appropriate person.
So two questions. One is related to the agencies that use the image trend software that our office provides. I was waiting until the conclusion of this call to turn those on for folks using the state default run form template. For agencies that are using ImageTrend but don't use the state run form template, they would need to go into their own run form and add those elements individually. The other elements that I mentioned, I will make sure gets into the next director communication that goes out. And I have already sent out a message to my contacts at the various PCR softwares that they're going to have an influx of their Kentucky clients requesting those elements. So they should be primed, ready to go.
Thank you, Drew. The next question is there any regulation that would prevent us from transporting a patient to an immediate care center rather than an ER? And no, there's not. There's not a regulation that states that EMS must transport a patient to an emergency department or a hospital from a scene. There are civil liability things that you have to deal with, but under the ET3 platform that Bowling Green was just awarded down at the medical center, treat and refer and treat and transport to alternate facilities is actually encouraged. There are reimbursement ramifications with that. If you treat and transport to an alternate care facility that's not a hospital emergency department, you may have difficulty in reimbursement under certain commercial and federal payers. So, but there's no state regulation that states that you have to transport a patient directly to the emergency room or to a hospital. So I would check with your local billing company, whoever does your billing, or your billing agency in-house, and ask them how that may affect your revenue stream. Stand by for the next question, please. Paul Phillips is going to take the next question.
The next question is there any guidance on using the transport pods for the long distance transport of patients? Currently, we don't have any of those, any guidance on that. Really and honestly, the last I'd even heard of the transport pods was during the Ebola issue. So we don't currently have any guidance on it, but I don't know that anything precludes an agency from using those if they're available.
Thank you, Paul. I'm just now take a look at these. Let me see. Is it the green one here? Will a draft of the emergency regulations be shared before enactment so agencies can begin to develop acceptable plans? More than likely, no, they won't. More than likely, those emergency regulations will be developed and based on survey data that you provide us as far as the availability of staff that is being reduced because they have exposures or they're in quarantine or in isolation. That's the time that those regulations will be enacted. And there's not going to be a lot of, there's not going to be anything new that you're going to have to report or carry or anything like that. That's not our vision. Our vision is that those regulations will be put into place, will modify minimum staffing guidelines, will modify minimum equipment standards, and will modify response standards as far as time and triage, et cetera. So it will probably not be shared before it's filed with the governor's office. When we get to a point or a threshold where we feel like those emergency regulations or executive orders are going to need to be filed by the governor's office, and we feel that the governor's office will sign those for us and get those enacted, that's when we'll roll those out to you. Under normal circumstances, that may be 48 hours because we're trying to get a head start on it. That's why it's so important for us to know when you have staff that are on quarantine or in isolation. If we don't have that information, then we're not going to know when we hit a staffing threshold where those emergency regulations need to be put into place. At this point in time, we have 22 patients in the state. I'm not aware of any additional crews that are in isolation or are in quarantine right now. So it should be daily operations, with the exception of some supply chain issues that some of our agencies may have. What we're trying to do is lean forward and make sure that when and if we have those staffing shortages or equipment standard shortages, et cetera, or we need to take time to plan a case as far as an emergency response, doesn't turn into necessarily an emergency response anymore because a patient is being self-isolated with COVID-19 and we've been asked to go and get them and take them to the hospital. We want you all to be able to plan those cases out and not have to respond within 2 minutes to those cases. So those emergency regulations won't be shared. I hope we don't ever have to put them into place. But if we do, we'll probably give you about 48 hours notice. And the 3 things that I mentioned are our major focus on the emergency regulations.
We're at 20 minutes. We've got 5.
Okay, we've run out of time for questions for today, so I would ask that the individuals that have questions will address your questions. And do we have the names for all the questions? The people, I think I know the majority of these people. That's Billy Ball, Jim, Jason Taylor, and Hazard, T. Ford. I don't know who that is.
They're included in the chat.
Okay. All right, so we'll get back with you on the questions that are still in here, and as well as you can submit a support ticket now to us if you have questions about COVID-19 to the KBeam support portal that's on our website. And I just want to tell you all that I'm proud of you. I'm proud to be a part of EMS in Kentucky, and we're going to face some challenges. And main thing is it's just like going out on an ambulance call. Don't lose your head. Don't freak out. Just be cool. Take care of your patients. And we just want to make sure that you got all the resources that you need, whether that be human resources or physical resources. And I'm going to close this out, turn this over to Executive Director Pointer. Once again, Mr. Pointer, you're unmuted.
Thank you, Chuck. I want to pass along, I just received a communication from the Department of Public Health, and they advised the link to request PPE is temporarily down on purpose. They just received a couple of deliveries from the SNS, the Strategic National Stockpile. So if you go to that link and it's not working, it will in the very near future. So to close out, ladies and gentlemen, I want to emphasize this is a serious situation like we've never faced, and we need serious professionals to help run this. The governor is relying on us for guidance. When I say us, that's EMS, guidance and leadership. They're asking us questions. How do we do this? We have to work together. It's not an option. We've got to be professional and communicate. We've been preaching and talking with folks. It's as simple as the 3 C's, stay calm, stay clean, and communicate. So with that, I would like to close and say that we plan to have calls weekly as much as we can. I cannot guarantee that right now. I will guarantee that if something comes up on an urgent basis or manner, we will notify everybody and do something quickly. So we've got to communicate also. That's part of our job, just like yours. Our operations are modified, as Chuck said earlier. We are not operating under normal situations now. This is a very modified business operation. Like I said, we will probably be staffing the EOC and dispersing information for the minimum of 4 to 6 weeks. So we could be on up into late spring, early summer. Reach out to us, go to the portal, submit a ticket if you've got a question. We will try to get those answered as soon as possible. I assure you that. So with that, I will say you be safe, use common sense, and Godspeed. Thank you, folks. We appreciate you.